The opium poppy, source of heroin, the drug that devastates lives and often kills. But opium has another side. It's the source of two medicines, methadone and morphine, which can improve and prolong life. But the fear they will be abused means many countries ban their use, depriving those most in need, even though they are globally accepted as essential drugs. Half of all the opiates produced from the opium poppies of Afghanistan are trafficked through the mountains of Kyrgyzstan. As a consequence, a lot of heroin is available. 1 in 50 people in the country are drug users. It's injected to get an immediate high. Needle sharing has led to a dramatic rise in HIV infections. Sergei is 35. For 14 years he's battled heroin dependency, which began when he was a medical student in Bishkek.
When you use heroin, you feel high, then you feel drowsy. You will need money for your next fix, and sometimes you are running around all day to get money. If you don't get heroin, you can't sleep, you feel shaky, you feel agitated.
Sergei is also HIV positive, contracted through needle sharing. But when he sought medical help, he felt shunned.
I decided to make my status public because when I told people about my illness, I felt negative attitude towards me. I wanted to change something so that people would understand us. Because once you have this illness, it's hard to mix with society. You get pushed away. The main problem is that when you tell doctors, they don't know how to treat you.
In Kyrgyzstan, 80% of new HIV cases are drug users. Sharing needles spreads disease. Methadone helps people break their dependency without using needles, preventing the spread of HIV. Because of his experience, Sergei started a support group to provide help to others like him. Sergei's wife, Elena, was also a heroin user. She's now helping to run the support group and bringing up their 2 young children. Kyrgyzstan has 4,000 officially registered drug users, though international agencies estimate the country as a whole has at least 100,000. The government has introduced the opium derivative, methadone, to help break heroin dependency. While methadone is used widely in Europe and North America, most Central Asian countries ban its use. Many in Kyrgyzstan, including Sergei, doubted it would work.
There is a lack of information about the methadone maintenance program. People don't know much about it. For example, when I first heard about it, I was against it. I thought it might make me worse. I thought I would become addicted to methadone, so it would be worse than heroin.
The law enforcement agencies were afraid that methadone will be illegally used and shared by users. But if we don't provide a substitute, they will keep using heroin.
The methadone program has been running since 2003. Evidence suggests it is successful. Certainly the experts believe it's safe and effective.
There are countless studies to show that methadone substitution treatment is very effective in treating addiction and that it can resolve the health problems and social problems of people who have addiction to opiate drugs. But many countries still prefer to treat drug addiction only through what we call drug-free treatment programs. So the idea in these countries of providing somebody with a substitute drug so they continue their use of drugs but in a much safer way is a very difficult moral and political issue in many countries.
Control of and access to methadone and morphine is governed by the UN's International Drug Conventions. The aim is to stop the supply of illegal drugs. But it also means people who need the drugs for medical reasons don't get them. The hope is this can be changed.